It's been over 500 days since everyone's been really working from home, and hearing the COVID-19 number cases just rise and fall. From your perspective, how has this pandemic really affected mental health over this year and a half?
It's been really interesting in terms of when people have come to see me, or even just my friends or people at call the office. Anybody says, "Oh, you must be, seeing a lot of people because of the pandemic." And it's not that I didn't expect that to be reality, but what I found is people see me because of the effects of the pandemic, not the pandemic itself, right? So it's like the secondary things, right? So people struggling with work and how that's been going since the pandemic, or with family, or with lifestyle or health, or right. It's all like it's almost the things that almost existed before, but are just, as we say, like exacerbated. So they're just made a bit more intense, right? And then then that creates anxiety, depressive type stuff. Sometimes, really serious things like self-harming and disappearing at times, teenagers taking off, or self-isolating, lots of things that, that come to the surface. That's really what it's more just intensified. So when people come to the office, maybe if I saw them not during a pandemic, it would be, I'm here. It's nice to talk. I felt like I needed to talk to somebody. Maybe I can work through some of these things. But now it's, hey, this is going on. It can't go on anymore, or I don't know what to do at all. So it's just a bit more intensified, but that's understandable. But it's been interesting to see exactly why people are here, and it's not necessarily why the general public would think they're here.
One thing I wanted to quickly chat about, and this might be off topic for you or anything of the
Yeah.
sorts, but a recent study just came out of the United Kingdom, that was done on quite a few thousand people who have and haven't had COVID. And they tested their mental health and their IQs from before and after COVID. I'm not sure if you've seen anything on that, but the people afterwards are experiencing forgetfulness, loss of their vocabulary, forgetting on how to do things that they previously knew how to do before the pandemic. Have you noticed any of that, or any of that with any patients coming into your office or anything of the sorts?
Um, I have read that. And I think those things are going to be things that we learn more about as the next year or two go on, when they can perform more studies. I think it's going to be hard to tell, like, what is a direct result of COVID, or is it like a correlational thing? Because I think it's hard right now to tell. Was it COVID-19? I mean, this is a researcher's job, but is it COVID-19 directly, like the virus that caused damage in an area of the brain, or is it mental health related, stress related, and when they treat their mental health um, stuff, then maybe those capacities come back. Um, we don't know. I know I have read things where it seems highly, highly likely that it has caused bodily damage in ways that people don't expect. Like they think, okay, I got my sinuses were really impacted by it, or I had really severe headaches, things like that. But we don't think about what some researchers are warning, where it's like, hey, we don't know what it has done to your kidneys, or to this body part or that body part. So I think those are things to come, that we will find out about more. But in my office, from what I've seen, um, I can't say I've seen a ton of people that have self-disclosed if they've had COVID. Some people I imagine did, because they kind of switched to online abruptly and when they were coming in person. Um, and what I can say is it's really hard at this point to tell the difference between, okay, is it stressors that's causing this, maybe forgetfulness or other cognitive issues, or is it COVID-19 period? You're going to have to see, I think, the more psychological or neurological fields come together with the biological fields and researchers, and it's all going to have to just come together to really figure that out. So yes, have I seen negative impacts of COVID on cognition and mental health? Yes, but that's all I can really say.
Okay, and that's good to know and good to hear, just because I know throughout this pandemic, some people are, well, everyone really is going blindly through it. We're trying to figure out what's going on with COVID on a day-to-day basis, and sometimes, you know, a side effect pops up, and we've only been a year and a half through this pandemic. I know it's only a year and a half, but
Yeah,
it feels like forever. But side effects can pop up years after, and we just don't know the long-term effects of possibly having this viral infection.
yeah.
Um, but now we're seeing the light at the end of the tunnel, at least we're hoping so with this pandemic. Um, how is this affecting mental health? Is there any kind of positive outcome? And really, what could be the damage that someone could face, or that we could face as a society, um, if we are to experience a fourth wave of this pandemic?
Okay. So the one thing I will say is, as frustrating as to a majority of people, the phases that Ontario's implemented have been, I always try to tell people, we talk about mindfulness. So it's, the basic definition is, be here in the moment right now. That can be easier said than done. Um, but the way I kind of look at mindfulness when it comes to the pandemic is, with our phases, it's okay. Phase two, they're saying we are allowed to do these things. I say, well, that's fantastic that we're able to do these things now that we weren't able to. And yes, you can jump ahead and get frustrated about, well, I still can't, and I still can't do this, and I still don't, right? You get momentum going with that. And, some people say negative thinking, but we call it like rumination or racing thoughts, and they just build on one another, right? And people think of like, well, that's stress inducing or anxiety, but it's also frustration inducing too, right? So you can get yourself in these zones. Like, you don't have to be depressed or having a disorder. You can get yourself in these mindsets of negativity, really. I mean, that's kind of a blanket term, negativity, but you really can. You can set the tone for your day or week sometimes when you involve people that are always in that mind frame, are always watching the news, that is always talking about those types of things. So I just say focus on what you can do right now. Okay, I've been waiting for the gym to open because that is one of the tools I use for my own stress, right? I do not go for to look good. I always say to clients, I go for up here, right? I've been waiting for that. So am I happy really that sometimes the gym is at capacity? I have to wait, right? No, I am thankful. I have gratitude, the keyword's gratitude, for that I can even go. And I've been waiting months. I can wait 15 minutes for one person to leave. So now I can enter the building, right? So switching, I would say perspective taking. When you get on that, frustrated negative road, that's when we flip to, I have gratitude for, I can at least go to the gym or to the mall, right? Then phase three will come. Phase three came. Hey, look, now you don't have to wait for the gym or wait to get in the mall, right? Steps are happening. Maybe they don't happen at the speed we would all like, but they are happening, right? So another thing, it dispels that, well, this is never going to happen. It seems like it's never going to happen. Then we can kind of reverse, well, we have stayed on track with the reopening plan. We even opened 2-3 days early for this phase, or 2-3 days open for that. So it goes back to, okay, perspective taking. Let's pause here for a second. We're getting frustrated going down this doom or gloom road. Let's look at what we do have. And then you said possible fourth wave. Okay, that doesn't sound fun to anybody. That sounds exhausting and terrible and like we're already saying, will this ever end? But will it get worse? Will be the wording people will say, right? Well, I was just actually talking to a client today about, again, kind of putting things in perspective where this person has, for as much as I can say to you, they have a health issue, a physical health issue. And there is a possible surgery that could address the health issue and change their life. But there's a small chance that it could also cause other issues, right? And I use the example of when we watch TV, we see these commercials for new medication, right? And it says it can be great for psoriasis or something, right? Talk to your doctor, but it can cause this, cancer, blah, 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 right? And when people laugh at those commercials, it's like, why would I take this? Because it's got all these side effects, right? But we have to remember, we never look at the whole picture where with those medications, maybe they did a study of 500,000 people in this medication. If one person gets lymphoma or something like that, then they say, well, it's a possibility that this medication contributed to the lymphoma, right? 1 in 500,000. But the commercial just shows, hey, you could get lymphoma from taking this medication. That's all we see, right? So relating that back to the pandemic and possible fourth wave, all we see is the biggest headline, right? Fourth wave would mean, in our minds, would be no school again, back to video, more maybe for people that would like to get vaccinated, more vaccines. People that are angry about that, they're going to get angrier. It just, right? Everything's going to be doom and gloom again, right? We do not know that, right? If we look, I always say, read further into things, not the headline, right? The headline is to grab your attention, but in today's world, it is the whole story, right? Really get the whole story. And not only that, from multiple sources, reputable sources. And a lot of the time, which I practice what I preach, if you read the whole story, it will say, maybe the headline's possible fourth wave, warning, right? Read the whole thing. Well, even if there was, they're saying it would not be as bad as any of the other waves. They do not expect a fourth wave to, we're done with lockdowns, basically, is what they're saying. And we would manage as we go and in regionally, right? But we catastrophize, as we say it in counseling, where it's just one big, no, everything's terrible again. No, we got to look at, break it down. Okay, maybe, hopefully not. Brantford has a bit of a fourth wave. Our numbers spike. Could be just a spike. Maybe they shut down. It happened at the mall. Maybe the mall's closed for a week or two, but it'll open again. Right? Perspective taking, looking at the whole picture. That's going to be key, and the whole story. That's what I tell clients.
And I really like that you said that check multiple sources, and that's exactly it. It's don't focus on one news outlet or one type of research or anything of the sorts. It, get your knowledge and base your opinion off of multiple sources. Do your
Right.
research and broaden what you're looking at. Don't just look at one news outlet, one resource. This has got to be it. They're the right. Everyone else is wrong. Cover it and see what other outlets are saying. See what other research houses are saying, and like a university over here will say one thing, a university over here will say another.
Right.
And that's, yes, you're exactly right. Is that's the main thing, is to, if you are even in amongst this COVID information, because it seems like it's never ending, and unfortunately a lot of the research can be a little depressing.
Right.
But if you are looking at it, get it from multiple sources. You're 100%
That's right.
right.
That's right. And
uh,
I've said throughout this whole thing, and I don't think it is a controversial thing, and I think anybody could agree with, education with anything like this is key. Just education, period.
exactly. uh, so when it comes to finally coming out of this pandemic, It's going to take a lot of work for people to recover mentally from what we've gone through. This has been the worst pandemic in all of our lives, in recent history. What can someone do, or what can a person do to really help someone they know who is going through a difficult time and may need some help to kind of get at least back to their feet to start moving again?
Right. So I'm glad you asked that because I'm starting to see it and I'm having to kind of educate clients on it, that it's a really surprising thing to a lot of people that don't necessarily need to come to counseling, but they see it in others. They're not understanding, okay, we're in phase 3, it's the summer, everybody should be happy, right? But what has remained is it really hasn't changed much in terms of mental health, unfortunately. Okay. So what I have to explain to people is it's very similar to, and I'm just using this as more of an extreme example. It's just the same like mental process. Okay. So soldier goes away to war. They come back, but a common thing is they just don't feel right when they're back, right? You're not present. They just feel comfortable. They want to go back to Afghanistan, wherever it is. And people say, well, why would you want to go back there? Right. So now that we've been in multiple lockdowns or living a different kind of lifestyle during the pandemic, what's happening is we have these freedoms now. And especially with teenagers, parents not understanding where it's like, hey, you can go hang out with your friends, right? If you've taken proper protocols, right? The numbers are down, whatever. And they're still in their room. They're still playing games in the middle of the night. They don't seem as happy. They're irritable. Why is this the case? Right? It is a psychological thing that is what we have adapted to. And change is not easy. To flip from one to the other and back is a process, and it can take time. So there was I believe a clinical psychologist on a podcast I was listening to recently, and they were saying this pandemic, the results of it do not stop. They will last 2 to 3 to 4 years, even after it is quote unquote gone. And what they meant by that is the residual effects on things like mental health, possibly physical health. And it's just basically educating and getting people to understand that, it's going to take time. And I know we've been through a long time already with all of this, but one is educating yourself on, if a friend or family member still seems to be struggling mental health wise, why they are. And if Google is not giving you an answer, then please call an office like mine, right? It doesn't have to be me, it can be any mental health professional. And just to have an understanding of why. I find that is huge, because we all make assumptions, right? It is sunny out, it is summer, you have freedoms equals happiness. That math does not always work, unfortunately, right? Second thing, one of the most basic things I tell anybody, pandemic or not, there is never anything negative that will happen by going to counseling or therapy. Nothing, right? First thing I do when a client comes in my office, I say, there's no couch. You will not be laying down. I will not be psychoanalyzing you. You are actually the boss. You run the show. We talk about what you want to talk about. If you want to come in here and tell me the most tragic story ever, and we will deal with some anxiety and trauma, we will do that. But if you come in and tell me I'm a little stressed with work and I just felt like I needed to talk to somebody, that's completely fine too. There is no shame, because that exists a lot, where, I'm not going to take up a counselor's time, or I can handle this on my own and I shouldn't feel like I have to talk to, right? That's all myth. I mean, I have people that society might say, well, why do they go to counseling? And I have people that society would say, absolutely, they should go, right? There is no rule really, right? So if you are feeling, some people would use the wording off, or just not right, or noticing, I would say educate on really what is going to happen in this room with me or whoever the counselor is. It really is a conversation where we figure out how to implement the tools and strategies in your life Hopefully you can carry on daily without me eventually to feel better. That is the goal overall, right? Much more simplified than the, I would say, I always just say myths of counseling.
And I'm really glad you mentioned that, and it's from the millennial generation and to the most recent one. Um, those generations I'm feeling are more open to discussing about their mental health rather than those earlier. So we're seeing more people with social anxiety, agoraphobia, just fear of speaking in front of people, and I can't even imagine what this pandemic has done to people who are suffering from those situations, because big groups were made to be feared because they were COVID super spreaders. You could get sick, you could die, et cetera, et cetera. So
Right.
I can't even imagine what that had done, or what kind of toll that would have put on people.
You know what has been, I always want to remind people too of like the positives with the younger generations, because I mean, I'm technically a millennial, so millennials and Gen Z, they don't get a lot of credit for things. They get a lot of criticism,
Mhm.
right? For how they manage their lives. What is amazing and what I want people to know is I've been so impressed the past, I'd say since beginning of June, late May, how many young, not just young men, which is fantastic, young women coming to see me that their families have no idea that they even come here. I have multiple clients, they pay from their part-time job or whatever to come see me, which is unbelievable. They're 16, 17, 18. And I have one young man, great guy. And he's like, I just feel off. I just need somebody to talk to. And I don't really want my dad to know. And that's his right. And it's awesome. We reversed 10 years ago. That did not happen. So there's really good things happening. And that's a really responsible, because that's a myth that, you know, millennials and Gen Z, they're not the most responsible, or right. No, that's a big step. I say, like, you know, that is courage to do that, right? Really, really big.
Exactly, and it's the fact that they have the strength, that and they have the strength and they have the knowledge that they know that they need the support and they need the help
Yeah,
to progress, and that's exactly it. Is that it's really respectful, and responsible to be doing that, that to notice that that situation's going on and to respond to it that way. So exactly.
yeah,
Um, Now just switching to if someone, so like if someone doesn't have an office like yourself,
yeah,
um, in their area that they're living. I mean, this show broadcasts all across a large network, including those who live in rural communities and might not be able to get to an office like yours. I mean,
yeah,
CMHA Ontario severed ties with the Huron Perth branch of the organization in Stratford. So that reduces a lot of resources out there. How
yeah.
can someone help themselves when if they don't have access to a lot of mental health resources?
Okay. So yes, situations like that, super unfortunate. It can be really discouraging when those things happen. I always say help is out there. You just have to find it. It can be difficult. Unfortunately, it should be easier. I 100% agree. We could talk about that forever. Um, but leaning on other services that their job is to find you the help is key, right? We always put that, a lot of times we feel like we have to find it on our own. There are organizations that their job is to find you the immediate help, right? So I keep it simple, because I always tell people, call telehealth. That is their job, is to provide you with resources. They can give you limited health information, right? You call, maybe you have a cold, you want to know if you can take an over-the-counter medication. The nurse on the phone will tell you. But you can also, there's no rule that says you can't call about mental health, and they can tell you, okay, in your area, you need to call this number or visit this location, right? They will tell you where to go, right? And if you get discouraged, because we all encounter stories of, we would say, like poor customer service, or they didn't give me what I was looking for, or it was disappointing, right? Don't stop. There is an organization out there that will see you. If you have to go to, and I have no problem with this, if you have to go to the emergency room and tell them this is what's going on and I have nowhere else to go, that is completely fine, right? Again, it's like this stigma we put, well, you go to emergency rooms for emergencies, right? Or you go to counseling for if you are in crisis. Myth, right? You go as a resource. If that is the only place that you can think of to go right now, because mental health, as I say, mental health is health, then you go there, right? I've sent people, because we're in Paris, I will send people to the Willet, right? Urgent care, because there are qualified doctors there that can at least provide it an evaluation right now and provide you a resource, right? I have people that they could not afford to come to see me. They go down to the Willet, they get a little evaluation at the intake, they talk to the doctor, they get set up with counseling through the Brant community healthcare system, right? I've had people get in within weeks. Until then, if they need to talk to crisis, you can Google St. Leonard's. They have a crisis line. Those people aren't unskilled, they're very highly skilled in giving you the tools that you can use right now, right? I guess the last thing on that is, do not listen to the rumors or online reviews or what a distant friend or acquaintance has to say about this organization or that organization and how they didn't treat my sister well and blah, blah. No organization is perfect and everybody has a story. Overall, we have great services here and in other towns. Lots of people that care. It's just, don't give up. You will find the resource. Use whether it's you have to go to Emerge or you call telehealth, their job is to find you the resource, and it is their ethical obligation to do that. So really, yeah.
That's absolutely wonderful to hear, and I mean that you're again, you hit the nail on the head, and that's absolutely perfect. Now, what would be the contacts? Say if someone wanted to get in touch with you or get information from you.
So I'm in Paris at Brant Mental Health Solutions. So I live in the north end of Brantford, but it takes me like 10 minutes to get here. We're right downtown. You can call us at 519-302-2300, or you can go to brantmentalhealth.com. And I will just say the reason why I'm at this office is I'm a believer in specializing. So we have anything you could think of in mental health where, postpartum things. I have really high anxiety or stress. I have grief. That's what we offer. And I believe that's what offices should offer. We are not the only ones, but we are, a newer office. We've been here 2.5 years, and we tend to get people in pretty quickly, which is something we need to address in Ontario, is quick service. And yeah, so that's where I am. We're right over the river. It's a nice place. But anybody that is qualified is good. It's not just me, but that's where I am.
Perfect. And thank you so much, really, for taking the time to really chat about this today. I really appreciate all the really valuable information you've shared.
Absolutely, anytime.